Dr. Kesiry, thanks for joining us here on Health Connection. We're talking about anemia. It's more common than you think. We like to start these segments off with a definition. So what is anemia and how common is it?
Anemia is a medical condition in which your blood lacks enough healthy red blood cell or hemoglobin. Red blood cells are important because they carry the oxygen throughout the body. The hemoglobin is the main part in red blood cell, and it's iron-rich protein and gives the blood its red color. This protein carries the oxygen from the lungs to the rest of the body. So when you have anemia, your body doesn't get enough oxygen it needs. How common? Anemia is common. By some estimates, up to 30% of world's population. In the United States, it's the most common blood disease. It affects about 3 million Americans.
Are there different types of anemia, and if so, what are they?
There are many types of anemia, which are divided into 3 groups. The first group caused by blood loss. Second group caused by red blood cell, decreased red blood cell production, such as leukemia, thalassemia. The third group caused by high rates of red blood cell destruction, such as hemolytic anemia, sickle cell disease, or aplastic anemia. Now, the most common cause of anemia is iron deficiency anemia, and that's when you have too little iron, because you have lost a large amount of blood, or your body doesn't absorb enough iron, or you're not getting enough iron in your diet.
Okay. What are the symptoms of anemia, and do they vary depending on the type of anemia that you have?
The main symptoms of most type of anemia is fatigue, feeling tired or weak, no energy, and especially if you're trying to exercise or walk upstairs. You may have other symptoms such as shortness of breath, dizziness, coldness or numbness in your hand or feet, pale skin, chest pain, rapid heartbeat. Now, mild to moderate anemia may cause very mild symptoms or not at all. Symptoms tend to be more pronounced. Symptoms tends to be worse during the exercise because your body needs more oxygen.
How is anemia diagnosed, doctor?
To diagnose anemia, your doctor will likely ask you about medical and family histories, medicines, your diet, alcohol intake, ethnic background, and your doctor will likely perform physical examination and order blood test. The blood tests are very important because they will not only confirm the diagnosis, but also will help point underlying cause.
Are there risk factors for anemia?
Factors that may raise your risk of anemia include blood loss, diet that's low in iron, vitamin B12, or folate, long-term or serious illnesses such as kidney disease, diabetes, liver disease, HIV/AIDS, cancer, heart failure, long long-term infections and family history of inherited anemia,
Mm-hmm.
such as sickle cell anemia or thalassemia.
Let's say I'm feeling tired and I think I may have anemia and I just feel a little bit run down. Can I just take a daily iron or vitamin B supplement?
Iron supplement or multivitamins contain irons should not be taken without consulting your healthcare provider, because the potential risk of iron overload. So if you have symptoms of anemia, you'll need to see your doctor and to find out if you have the condition or not.
Okay. How serious a problem is this? How serious is anemia?
In general, anemia has very good prognosis,
Okay.
and it's curable in some cases. However, the overall prognosis depends on the underlying cause,
Right.
the severity, and the overall health condition of the patient.
How is anemia treated once you have a diagnosis?
Treatment of anemia depends on the type, cause, and the severity. But the goal of treatment to increase amount of oxygen the blood can carry, and to treat the underlying cause.
What can we do, doctor, to avoid becoming anemic in the first place? How do we avoid anemia?
Treating anemia underlying cause may prevent the condition, but you may able to prevent repeat episode of anemia in certain type of anemia, especially if caused by iron deficiency or lack of vitamins.
Very well. Doctor, thank you very much for your time.
Thank you very much.